So my name is Gabriel Gallardo. I'm from the University of Hong Kong, and today I'd like to talk to you about a new treatment for cancer called particle therapy. So I'd like you all to imagine that you're watching a Batman movie. And imagine you're in a room, the Joker is over here, and the door is over there. And in between the Joker and the door is a bodyguard who is there to protect the Joker. And what's going to happen when Batman comes into the room? Well, in order to get to the Joker, he's going to first have to fight his bodyguard, right? So he'll fight him, break his bones, knock him out, and then move on to the Joker, right? This is what we always see in movies. What if the situation was that this guy was not actually a bodyguard, he was a hostage that the Joker took. And Batman still comes in, ta-da, but he uses all of his energy, beating up the hostage, knocking him out, breaking his bones, and then finally, he's tired, and he has to fight the Joker. It's kind of strange, right? No one would fight crime like this. But actually, this is how we fight cancer. Using a technique called radiotherapy, we can use X-rays to target cancer cells inside the body, and when they're deep inside the body. And what they do is they beat up the DNA of cells, and hopefully that will make them die. But what happens is when the X-rays come into the body, they don't care whether they're beating up healthy cells or cancerous cells. And as they go in, they get tired. And so in order for our tumor to get the right amount of dosage of radiation, we need to use really energetic X-rays that really beat up healthy cells before they reach the tumor. And this is a problem, because when we damage healthy cells on the way to treating cancer, we could cause secondary cancer. And I guess you can all agree that that's not very ideal. What we can do, instead of using radiotherapy, instead of using X-rays, we can use something called particle therapy. Particle therapy makes use of really, really small particles called protons. They're so small you can't see them. But when we fire them out of a gun and into the human body, they don't do much. They don't do much until they arrive right where the tumor is and wham! Knocks them out, knocks them dead. And you can also adjust how deep these protons go by controlling their energy. So a more energetic proton might go one step. A less energetic proton would go one step. And a more energetic proton might go 3 steps. And we can use that to treat tumors of cancer at different depths. This technology is still somewhat in its infancy. There are about a dozen treatment centers all over the world, but it's showing promise to be a more effective and a more targeted and a more safe approach to fighting cancer. Thank you.